Addiction doesn't take a break just because there's a pandemic. In fact, the situation may be getting worse. Nick Dunne is our Ontario Hub's journalist covering the Northeast. He joins us now from Sudbury for more on the opioid crisis during COVID-19. Welcome to the show, Nick.
Thanks for having me, Jan.
Now, we've been really focused on COVID-19, but a lot of people have probably forgotten that there is still an ongoing crisis with opioids. And I thought we would start off before we get into your article about why opioids are so lethal.
Well, opioids are a synthetic derivative of opiates. So, opiates like heroin or codeine, these are naturally derived. Opioids, on the other hand, are synthetically made and can be up to 50 to 100 times more powerful than morphine. At least that's the potency of fentanyl, the most common one you find on the street. And not only that, but, substances like fentanyl are being cut and used in things that aren't necessarily opiates or opioids. You see it in your stimulants, your cocaine, your methamphetamines. You're seeing higher levels of addiction because it's in these other substances. So you might not be taking opioids, but you might have a fatal level of opioids in that substance.
Now, in your reporting, you talked about how there are opioid overdoses and deaths have actually increased during the COVID-19 pandemic. Talk to us about the contributing factors in that.
Yeah, so first I'll just go over the numbers really quickly. The median number of suspected drug overdose deaths per week in 2019 was about 44 people per week, which is significant. Since the onset of the opioid overdose, we've seen every week having above that level of the median. So we're looking at, over 44 people. And 9 of those first 15 weeks have seen a statistically significant increase. So we're looking at an increase of over 25%. So we're looking at upwards of 55 deaths per week in quite a few weeks since the COVID-19 crisis began. In terms of the causes, the opioid crisis is tied inherently to the hip with so many different social issues. So everything from joblessness, housing, the interruption of your daily routine, things being closed, the library, which I had written about on tvo.org, the shortage of food at food banks, which our colleague Charnel Anderson had written about on tvo.org, and even hidden homelessness being exposed, people not necessarily wanting folks in their apartment when they're trying to keep socially distanced, which our colleague Mary Baxter had written about. So there are so many different factors that go into why we're seeing this increase. But, we're looking at housing, homelessness, and just general life stress.
Now, I understand you went out with the Sudbury Action Centre for Youth when they were doing kind of a walk through the downtown. What can you tell us about that?
Yeah, so I went on a needle pickup tour with Joel Boivin. He is a harm reduction worker at SASE. We went along the streets. We picked up needles, where they're commonly found. He's kind of figured out where some of the common drop-off spots are. And, they're saying that they're seeing increased numbers. They're seeing it bloom outwards around Sudbury. So they're seeing, a real increase in those pickups. He was talking to me about how this is a crisis of suffering, not necessarily of addiction, although addiction is certainly the heart of the matter here. But, when suffering goes up, when, people are homeless, when people are hungry, they're exposed to the heat outdoors, we're seeing more activity and we're seeing more hardship out there on the street.
Now, obviously, talking with the Sudbury Action Centre for Youth, have we talked about any kind of solutions?
Well, if there were easy solutions to this, Jan, I'd think, we wouldn't be where we're at. I think everyone I spoke to, from the coroner's office to public health to law enforcement and harm reduction, they all say that there's no simple solution here. We're seeing progress with the National Association of Chiefs of Police advocating for the decriminalization of possession. In Ottawa, there is the city council had advocated for a safe supply pilot that had worked quite well in Ottawa. Even the former chief of police, Vern White, had advocated for it. So we're seeing, definitely raised attentions to this, even with Dr. Bonnie Henry, the chief medical officer in BC. But, I think the number one thing we have to think about here is stigma. Getting to those reasons why people use drugs, and having, a frank conversation collectively about how we're going to do this. I think the COVID-19 pandemic has shown us that if there's significant political will, we can create large changes very quickly to address health concerns. I mean, COVID and opioids are two very different beasts, if you will, but we're seeing. It's a very complicated solution. It's very deeply tied to our society and various problems in society. But until we have those conversations, we're not going to see proactive or comprehensive solutions. It's only going to be piecemeal, which is kind of why we've seen these increases in opioid overdoses since this thing began 5-6 years ago.
Nick, it's always a pleasure to have you on the show. Of course, an important story that you've highlighted that we have covered on TVO.org in the past, and we will continue. Thank you again, Nick. That's Nick Dunne, our Ontario Hub's journalist covering Northeastern Ontario.
The Agenda in the Summer with Nam Kiwanuka is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.